This is one out of the many challenges faced by TB patients. Let's visit Dr. Bello Tamboa. He is the Program Manager of Tuberculosis and Leprosy Control with the Sokoto State Ministry of Health in northwest Nigeria to tell us more about tuberculosis.
Tuberculosis is actually a chronic infectious disease. It's caused by a bacterium called Mycobacterium tuberculosis. This disease affects the lungs in more than 90% of cases, but it can also affect other parts of the body. So it can affect the stomach. I can say literally, yes, I can say stomach rather than saying abdomen. It can affect joints and bones. I can say the brain. Virtually, it affects almost all parts of the body, but predominantly it affects the lungs in more than 90% of cases.
One would wonder how tuberculosis spreads. Dr. Bello Tamboa solves the puzzle.
It's an airborne disease. So if you have in close contact with somebody who has that disease and he coughs, you repeatedly inhale the bacteria, you are prone to have that disease. In fact, it's said that anybody with TB not diagnosed and not on treatment, averagely he can affect up to 15 people in air. So by coughing, by sneezing, by even talking with somebody who has it, on the average, if somebody talk only he has that, he can liberate like up to 200, that organism, that bacteria. If he coughs, he can release up to 3,500 bacteria on the air. And if he sneezes, that's even the main one, because sneezing may liberate up to 1 million tubercle bacilli into the air. So imagine you are close to such an individual. So that is how actually the disease separates.
Experts say over 1.3 million people die globally every year, while Nigeria is ranked number 6 in terms of the burden of tuberculosis in the world. Let's find out the prevalence of the disease in Sokoto State.
In Sokoto in particular, in 2021, that's last year, we notified 18,366 TB cases. Among them, 1,505 are children below 14 years.
There are different symptoms of tuberculosis depending on the area it affects in the body.
The cardinal symptom is that cough. But we should know that it's not everyone who has cough that has TB. So it shouldn't be taken that once somebody is coughing, he has TB. No, that's why you need to come to hospital. So, and that cough should be persistent cough that lasts for more than 2 weeks. They are coughing. Probably some of them may be going to chemist by chemist taking cough syrup. The cough will not go. They have been taking different types of antibiotics. The cough will not go. So cough that lasted for more than 2 weeks is actually it's cardinal symptom of TB. Other symptoms that may or may not be there are fever. May come usually in the evenings, but it may come anytime. And then weight loss. You'll be seeing that people, you are just kneeling, you are losing weight. And then you'll be sweating excessively, unusually. Other symptoms is that when you cough, you may have chest pain. The sputum will come out with mix of blood.
For risk factors, the expert explained further.
Anybody is at risk of contracting TB. Anybody in the society is at risk, as long as there's somebody in the society who has active disease and is not on treatment. We are all at risk. But there are some people who are at more risk than others. Those who are at more risk include, number one, the HIV patient with TB. Other risk group are the very young and very old, and maybe also be related to the immune system. It's not too strong. Those who are also high risk also are the healthcare workers.
We also spoke to a health worker who told us how they protect themselves from contacting some of these infectious diseases, especially tuberculosis, as frontline workers.
You see, we have several ways of protecting ourselves against tuberculosis. Some of which are, number one, we wear face masks when we are approaching patients, either in the ward or outside the ward. So if the patient is outside the ward, we wear just ordinary mask. But if it's inside the ward, there is one special mask that is made that filters air. We call it N95. So that's one we wear to enter inside the ward for those patients that cannot move. And we also give the patient health education on how to cough, sneeze. You know, you can get tuberculosis through all these routes. So they should also be on their face masks at all times.
Although reports say tuberculosis kills, Dr. Bello Tamboa has this to say.
Yes, TB is treatable, is almost like 100% curable, but we want patients to present early.
The duration of treatment of tuberculosis varies depending on the type of the disease.
We have different regimens. The commonest one we give is actually 6 months. There is another one that we can give for 1 year, especially, for example, TB of the bone or TB of the brain we give for 12 months. And there is another one also that we can give 9 to 11 months.
Let's visit Aisha Bello, a survivor of tuberculosis, so she can tell us her experience.
I started realizing some symptoms in my body that I'm sick. I also have severe cough, catarrh, and vomiting too. But when I went to the hospital, I'm now fine.
To find out what Sokoto State government is doing to curb the spread of the disease, the expert reveals.
The WHO, the Federal Ministry of Health, is actually quite happy with Sokoto State because of the strategies, the giant stride, innovations, commitment, dedication that we show to look, find TB cases, and that will make us actually number one. Diagnosis is completely free. You are not going to spend anything for diagnosis. You are not also going to spend a single naira also for treatment. You are going to be treated free.
Experts are of the opinion that early reporting of tuberculosis can save lives. Naomi Kongbenda reporting.